Thank you very much. I want to thank the Heartland Institute for organizing this conference and for having this session on health effects, which is a very important aspect of U.S. energy policy. I will now make the case that during the past 25 years, the American Cancer Society has conducted and promoted air pollution pseudoscience based on its 1982 cancer prevention study known as CPS-2. Major ACS epidemiologic research has been used to improperly justify very costly EPA air pollution regulations that have hurt America, particularly in the energy, manufacturing, and transportation sectors of the economy. The 6 major aspects of my talk are described here. Fine particulate matter, PM2.5, is defined by size, less than 2.5 microns in diameter, not by composition. It comes mainly from combustion sources like the burning of fossil fuels. In 1997, EPA first established the National Ambient Air Quality Standard, NAAQS, for PM2.5, based largely on the secret science epidemiology from the American Cancer Society. This NAAQS has been used to justify many multi-billion-dollar EPA regulations, most recently the Clean Power Plan. To put this pollutant in perspective, the average U.S. adult currently inhales about 1 gram of PM2.5 during an 80-year lifespan. This is the equivalent to inhaling about 25 cigarettes. The public health benefit of PM2.5 regulations is largely based on the claim of PM2.5 premature deaths and the assumed $10 million value of statistical life for each premature death. EPA uses unjustified and exaggerated assumptions to make this benefit claim. The major problems with PM2.5 premature death claims are these 6 factors. The most important factor has been the use of non-transparent and non-verifiable secret science. Also, there is no etiologic mechanism or experimental proof that inhaling a few grams of PM2.5 causes premature deaths. The American Cancer Society promotion of PM2.5 premature deaths began with the seminal 1995 Pope article based on CPS-2 data. The positive relationship of PM2.5 to total mortality was so controversial that a reanalysis was done by the Health Effects Institute and published in 2000. But the CPS-2 data were kept confidential. Indeed, the CPS-2 data remained completely confidential until I obtained an old 1982 to 1988 version of the data in spring of 2016. I published my PM2.5 CPS-2 reanalysis on March 28th, and it showed no PM2.5 premature deaths when based on the best available PM2.5 data. On November 3rd, I submitted to the New England Journal of Medicine a second reanalysis paper which shows no premature deaths due to PM2.5 or sulfates and identifies additional problems with the original findings. This 2000 HEI reanalysis map shows major geographic variation in PM2.5 mortality risk during the 1980s, with the largest risk in the Ohio Valley and no risk in California. This map agrees with my 2005 article, which found no PM2.5 mortality risk in California based on CPS-1 data. The map has made it possible for me to understand 3 key versions of the PM2.5 data. My primary March 28th results are summarized here. The best available PM2.5 inhalable particulate network data yield no relationship with total mortality nationwide. The original investigator data in HEI 2000 Appendix D yield a positive relationship in the Pope 95 paper. The data labeled PM 2.5 DC in Appendix D, which were very similar to the IPN data, yield no relationship. If the Ohio Valley and the other states are examined as separate areas, there's no relationship with any version of PM 2.5 data in either area. Thus, the positive PM 2.5 mortality findings in Pope 1995 and HEI 2000 are not robust and based on selective use of both the PM 2.5 and CPS2 data. This table shows the three sources of PM 2.5 data for 13 counties. Pope 1995 and HEI 2000 omitted 7 of the 11 California counties that had PM 2.5 data. These omissions have never been explained, and they further document the selective use of data. This summarizes the overall null relationship between PM 2.5 and total mortality in two major cohorts of the United States: the CPS2 cohort during 1982 to 1988, and the NIH AARP cohort during 2000 to 2009. There is no relationship in the United States as a whole or in California. These findings greatly weaken the EPA claim that PM 2.5 causes premature deaths. Who are the major promoters of PM 2.5 premature deaths? The first promoter is Brigham Young University economics professor Arden Pope. He holds a PhD in agricultural economics and has no formal training in epidemiology, and yet has co-authored over 15 secret science epidemiologic analyses of CPS data since 1995. He's repeatedly refused to address the serious challenges to the validity of his research as outlined below. In particular, he has refused to cooperate with the August 1st, 2013 House Science Committee subpoena of CPS2 data. Also, he's refused 4 invitations to national conferences to counter my CPS2 findings, including an invitation to this conference. Finally, he has not identified any errors in my March 28th reanalysis. The second group of promoters are the top ACS officials, including the Chief Executive Officer, Executive Vice President for Research, 2 Vice Presidents of Epidemiology, and the key data analyst. Dr. Susan Gapster and Mr. Ryan Diver refused my October 13th invitation to this conference. ACS has refused to comply with the 2013 House subpoena, has refused to cooperate with me and other highly qualified scientists, and has allowed the relationship between PM 2.5 and total mortality in the CPS2 cohort to be misrepresented and falsified since 1995. Finally, ACS has not identified any errors in my March 28th reanalysis. The third group of promoters is the Health Effects Institute in Boston, which never conducted a proper reanalysis of Pope 1995. In 1997, HEI selected a 31-member Canadian team to reanalyze 2 U.S. epidemiologic studies. The team included several statisticians and geographers, but not one qualified epidemiologist. The 2000 HEI reanalysis never tested the sensitivity of the Pope 95 results to the IPN data. But as mentioned earlier, I have now found a poorly labeled and incomplete version of the IPN data in Appendix D. The PM 2.5 DC data prove that the reanalysis team was aware of the IPN data before 2000 but never analyzed it. HEI has refused to investigate the strong evidence that Steve Malloy and I have invalidating HEI claims of PM 2.5 premature deaths. On May 13th, Lancet published a HEI Global Burden of Disease article co-authored by Pope, which, despite inflated PM2.5 death claims, provides indirect support for my above evidence. Table 2 states that in 2015, the U.S. had only 2% of the worldwide PM2.5 premature deaths and a mean PM2.5 level of only 8.4 micrograms per cubic meter. Table 2 clearly shows that the PM2.5 death rates and levels are much higher in China, India, and Africa than they are in the U.S. This 2015 World Health Organization map reinforces the Lancet evidence that PM2.5 pollution is concentrated in China, India, and Africa. Thus, the focus of future air pollution control efforts should be in those areas, not in the United States. The Honest Act, which was approved by the full House on March 9th and is awaiting action in the Senate, will, quote, prohibit the EPA from finalizing, proposing, and disseminating regulations or assessments based upon science that is not transparent or reproducible, unquote. This bill will make it possible to stop EPA from using secret science studies. The June 1st, 2015 New York Times editorial, "Scientists Who Cheat," reinforces my above points. Quote, "The scientific community clearly needs to build a better safety net. It can start by ensuring that scientists, especially peer reviewers, are allowed to see the underlying data of a paper," unquote. My conclusions: there's strong evidence from 2 major U.S. cohorts that PM2.5 does not cause premature death. Strong evidence exists that EPA, HEI, and ACS-CPS2 investigators have falsified the PM2.5 mortality relationships since 1995. The Honest Act must become law, and EPA NACs must be reassessed as per the Act. There must be an aggressive campaign to force ACS and the CPS2 investigators to cooperate with critics in conducting transparent and reproducible air pollution analyses. I end my talk by pointing out that Nobel laureate Sinclair Lewis wrote Elmer Gantry in 1927 in order to expose religious charlatans. We must not allow modern-day Elmer Gantrys to continue to promote the unproven secret science claim that inhaling a few grams of invisible particles called PM2.5 causes premature deaths. Thank you.